Sometimes erectile dysfunction is not really the disease, but it is a symptom. They found out that the more you have sex, the lesser the chance you might develop prostate cancer.
Good day, everyone. I'm Dr. Jing, and welcome back to MD in Focus, the show where we bring you valuable health tips and recommendations straight from our St. Luke's experts. Today, we're focusing on a crucial yet often overlooked aspect of men's health, urological health. Joining us is the esteemed Dr. Diosdado Limjoco, the head of St. Luke's Medical Center-Quezon City Institute of Urology, and he's also the president of the Philippine Urological Association. Dr. Dodge, thank you for joining us today.
Hello, good day, Jing.
So, Dr. Dodge, can you please give us an overview of common men's urologic issues?
With regard to the problem here in our country, in the Philippines per se, there are a lot of men who are already complaining of mostly when you grow older, these are the concerns of the aging male. Okay. The problem with the prostate. So like benign prostatic hyperplasia, and aside from that, this is the time they start to develop erectile dysfunction. Is also the time we want to detect the early stages of prostate cancer. And of course, on the side, we also see some of the patients with who develop kidney stones and some sexually transmitted infection.
Mga STDs
yes,
po, sir.
Right.
So these are very common in the practice of a urologist.
Yes, that's right.
Doc, what are the common symptoms of these issues? For example, sa prostate po, what do patients usually feel? Ano po ba yung nararamdaman nila?
We always ask this patient to seek consult already because we want to, if there is a history of cancer in their family, we want to detect prostate cancer earlier on. Aside from that, if they have symptoms like with regard to benign prostatic hyperplasia or enlargement of the prostate, this is the time they start to feel changes in their urination.
Okay.
There's weakness in the force of urine, there is frequency, there is frequent urination at night. These are the usual uncomfortable symptoms that will let them or that will ask or advise or seek consult to a urologist.
Okay, so in the vernacular, it's difficult. Mahirap pong umihi.
Mahirap umihi.
Mahirap ilabas.
Paputol-putol, parang may natitira. It's as if parang...
ihi ng ihi sa gabi.
That's right. That is the usual most uncomfortable symptoms that they will feel that they need to seek consult from a urologist.
So this would be for prostate.
That's
and
right.
For kidney stones po, what would be the usual
these
symptoms?
Usually the first sign that they will seek advice or consult to a urologist when they see blood in their urine.
When there's blood in the urine, okay.
Because that is quite alarming. When they see this blood in the urine, this is the time they will be alarmed, and then it's as if it is an emergency for them that they need to seek consult from a doctor, not necessarily urologist, but then this primary doctor or general physician will refer this to a urologist.
And I believe, sir, this is very painful. No? Napakasakit pong malabasan ng stone. Somebody told me that it was worse than giving birth. One of my colleagues told me that passing out a stone for her was worse than giving birth.
Yeah, that's right. It's really painful. Yeah, sometimes you cannot really tolerate the pain. No, even if you tell us that kaya ko yan, no? So hindi mataas yung aking tolerance sa pain, no? But then if you develop a stone that starts to move from the kidney going to the ureter, this is the time they will feel a severe pain that cannot be tolerated. Sometimes you cannot even taking those NSAIDs like mefenamic acid or like ibuprofen. Sometimes they don't give you any relief at all. So this is the time you see or you have to go to the emergency room to seek consult.
Yes, because the pain can be very severe.
That's right.
Dr. Dodge, what are the factors that can contribute to these conditions? Yung sa prostate illnesses, you mentioned erectile dysfunction, medyo madami po pala, no? And maybe stones. Right. So maybe let's start with prostate.
Sometimes the concern of the enlarged prostate also it is in a way involves or sometimes these patients also develop erectile dysfunction. Mm-hmm. If they will start to develop like difficulty in urination, no? This is paputol-putol yung ihi, talagang laborious yung paglabas ng ihi. This will also contribute to the development of erectile dysfunction. Okay,
I see.
So in a way, those patients with enlarged prostate eventually develop erectile dysfunction.
Oh, it's connected po.
Yes, and the reason why or the theology of kung anong dahilan kung bakit lumalaki yung prostate is dalawa lang. No, there are only the two reasons why you develop this enlargement of the prostate is one is age, and the second one is testosterone.
Testosterone,
Okay, yes.
the level of the hormone, the male hormone.
Yes, that's the male hormone. So we
it's
cannot
the aging and the male hormone levels.
Yes, so we cannot do anything about AIDS. No,
I
so we
see.
cannot give you medicine to treat your AIDS. No,
Yes.
so but we can give you something to control the level of testosterone. No, so this is the focus when we treat those patients with a large prostate. Usually, we focus our attention to the testosterone level of the patient. Okay, so we control the level of testosterone, and then we relax the muscle in the prostate.
I see.
No? So if it is a benign condition, this is the time we give some medicine to relax the muscle in the prostate so that they will have an easier flow of your urine, and then we give you medicine to decrease the size of the prostate.
I see. And this goes without saying that the medication should be prescribed, no? Because I believe over the counter or yung mga nabibili po kung saan-saan na mga testosterone po, no, na mga supplements may be dangerous if taken without a doctor's supervision.
Yeah, that's right. If you look at the social media, no, so this is the usual problem we encounter in our practice. So these patients will come to you, and they will tell you that they've been taking this men's health supplement.
I see.
And they've been taking a prostate health supplement. No, so there are a lot of studies already done in not only here, not only in the States but also here, and they found out that this supplement does not work at all.
No, doesn't work.
Yes,
Okay.
yes. So, so it's better probably to seek consult from a urologist to give the right treatment and the diagnosis of their condition.
And spend their money wisely on
That's
the correct
right. Yeah,
medications.
yeah.
And then you mentioned, Doc, that prostate disease can lead to erectile dysfunction.
Yes.
But we also know that not all erectile dysfunction is just because of urologic problems.
Yes.
Meron pa pong ibang causes.
Sometimes erectile dysfunction is not really the disease, but it is a symptom. No?
It's a symptom of a disease.
So they found out that the patients start to develop erectile dysfunction. There could be a problem with their flow of the blood blood flow in the penis. So if there is a problem, the blood flow in the penis, most likely there will be also a problem somewhere.
Okay.
Most importantly, in the heart. No, so if they will come to you with erectile dysfunction, it is better to have or seek consult also from a cardiologist.
Cardiologist as well.
Baka meron na rin silang tinatawag na coronary artery disease or something like that. So this is usually, sabi nga, if the patient do have erectile dysfunction, it is better to check also the heart of the patient.
I see. And also, sir, I believe mental health is also important to be taken into account. No? Because some people may just have depression or other issues that cause these symptoms. As you said, it's a symptom, not usually a disease. Okay, sir.
And sometimes it also compound the problem. So when you develop erectile dysfunction, you develop what we call performance anxiety. No? So kapag ka hindi ka nakapag-perform sa gusto mong mangyari, just like you want to have sex, and then you develop erectile dysfunction, and chances are you will have this performance anxiety, no? So baka hindi ka makapag-perform kapag gusto mo makipag-sex ulit, no? So it will compound the problem. So usually these are the things we want to address when we treat those patients with erectile dysfunction.
Doc Dodge, about kidney stones, how often do this happen in people, and ano po ba yung factors that can predispose to development of stones, like yung mga supplements po ba, kasi it's a popular belief. Is it true?
As I've said before, usually those patients who are taking too much of vitamin C, sometimes they may predispose to develop stones. No, so vitamin C is a ascorbic acid. No, so that will acidify your urine. No, especially if you are prone to develop uric acid stone, the chances are you might develop another stone again.
So, Doc Dutch, how much vitamin C is too much when you say na hindi po siya maganda for stone formers?
People taking vitamin C are thinking that vitamin C is anti-cancer. No, so antioxidant. no? So, but then if you are a stone former, no, so it is not advisable to take more than 500 or 1 gram of ascorbic acid.
In fact, the vitamin C recommendation is about, I think, 90 milligrams per day nga lang po. And the supplementations available are usually more than that. So
And
we have
it is
to be more
advisable-
careful.
It is advisable to take sodium ascorbate instead, no? So
Sodium
instead of
ascorbate
ascorbic
instead.
acid, kasi ascorbic acid will also contribute in development of GERD or peptic
Yes.
acid diseases,
Yes,
no?
yes.
So if you are to take vitamin C or ascorbic acid, might as well take it in the form of sodium ascorbate.
And consult your doctors first if
Much
you need
better,
it. Kasi
much
baka hindi nyo
better.
naman kailangan. You're
Much
also
better.
spending on something you might not need.
If you had a history of stone before, no, so there is a at least 50% chance that you will develop another stone in 5 years' time.
I see.
Okay, so sometimes even we advise you to take medicines like potassium citrate that will supposed to prevent the formation of stone. You still develop stone even then, no? So you just have to drink a lot of water, and as much as possible, you avoid taking too much salt. No, these
Okay.
are the only thing I tell to my patients, because if I tell them, wag po kayong kakain ng mani, wag kayong kakain ng steak, wag kayong kakain, hindi na mag-enjoy sa buhay yung pasyente, no? Pero ang sinasabi ko lang sa kanila, what I tell them is you have to drink a lot of water, at least 10 to 12 glasses of water, and you avoid salty food.
Okay, to help prevent
Kidney stones. Yeah.
Because 50% will recur in 5
5 years
years.
time.
Oo, in
No?
5
So
years
kapag
time.
nailabas mo yan, usually if the stones is pretty small, like 4 millimeter, you usually can pass it out spontaneously.
Okay.
Just drink a lot of water,
Okay.
even not taking any medicine. But then, if this stone will recur, chances are probably it will be bigger than before.
Oh,
no?
I
It
see.
will be much difficult for you to pass it out.
And then
So,
big stones can damage the kidneys po, di ba?
yes, yeah. If the stone stays in your ureter for a long period of time, you will not have symptoms anymore.
Ah,
No?
so that would be
so
a
ang-
silent killer kung baga quiet na lang po siya.
malalaman mo na lang yan kapag damage na yung
Ng
kidney
kidney,
mo.
o
So that
mataas
we
yung
have just to
creatinine.
remove. You just have to remove the kidney, not really the stone, but also the kidney. Yeah.
Okay, so it's good to keep that in mind, that we have to be mindful if we are stone formers, no? Especially avoiding a lot of salt in the diet and too much vitamin C.
Yeah,
May
that's
yung
right.
fad po kasi with over supplementation is kailangan po ring mabigyang pansin. So,
Yeah, that's right.
And then, Doc, let's go to infections naman po in the urinary tract or the urogenital tract. What could be the factors for these or symptoms po?
Urinary tract infection is more common among females, no?
Yes.
Because anatomically, the urethra of the female is shorter compared with the urethra of the females, of the males. I mean, of the males, no? If the patient if the male patient develops urinary tract infection, it is already a complicated type of urinary tract infection.
Complicated UTI, yes.
That means there is a reason why the patient developed urinary tract infection.
It must be found. It
Yes,
must be diagnosed.
there should be
yes.
a reason. No, there should be like STDs, like stones, like if there are tumors in the urinary
I see.
tract. No,
Okay.
but among females, usually we have what we call uncomplicated type of cystitis or urinary tract infection, which can easily treat by
Yes.
antibiotic. But for males,
all
pwede
UTI
naman
episodes
are complicated. No,
yes.
especially
they have to
kapag
consult.
kapag matanda na or when they reach the age of 50 or 60 years old, if they will develop urinary tract infection, most likely they have a problem in the prostate.
And has to be checked.
Yes,
and treated.
that's right.
Yes.
That's right. And especially if they have a history of cancer in their family, they have to be checked with prostate cancer.
What about STDs, sir? You mentioned earlier that it's also one of a common consult reason, ang STDs po, sexually transmitted diseases.
Yes. No, so
Not just in the older population po, but also among our younger
among
population.
younger.
Yes.
So sometimes what we see in our clinic, they do have an infection from another area, very unusual area. If you
Okay.
see an infection in the male or female in the unusual area, the recommendation now if the patient have or develop sexually transmitted infection, we have to screen this patient with HIV. No,
Already,
at
not
least
just
the quantitative. So after the treatment, like if the patient develop urethral discharge, no, so we advise them to undergo HIV examination. At least the qualitative. No, kasi and then after the qualitative test, if it is positive, that's the time we do a confirmatory test.
In terms of lifestyle changes or lifestyle choices, what could you advise our viewers in terms of taking care of their urological health?
The erectile dysfunction compounds with a problem with the heart. Okay, so that's why we advise them to refrain from taking a lot of or taking too much fat, no,
Okay.
fatty foods, or we advise them to take Mediterranean diet. No, what is Mediterranean diet? Usually, Mediterranean diet is composed of poultry like chicken, chicken breast, like salmon or fish, and vegetables
Lot
and
of
fruits.
greens.
No? So these are Mediterranean diet. No? So, and then aside from that, we advise them to do some exercises and stop smoking and refrain from taking a lot of alcohol. No? So
Okay.
these are the usual advice we give even those patients who have a problem with their hypertension, who have a problem with their diabetes. No, it is the same advice we give if those patients do have or start to develop erectile dysfunction. With regards to the prostate, no, we advise them to have sex because they found out that the more you have sex, the lesser the chance you might develop prostate cancer.
I see.
Kaya nga, sometimes we advise the patient na kapag medyo nakakaedad na kayo, hindi naman ibig sabihin na you have to stop doing sex, no? So or stop ejaculating, no? So it is a they found out in the study that the more ejaculation you have or the more sex, the lesser the chance you might develop prostate cancer.
Okay.
I will not tell kung gaano kadalas, pero
Okay.
mas madalas, mas maganda.
Mas maganda for prostate health.
Yes, that's
Okay.
right. Now, with regards to the enlargement of the prostate, sometimes we cannot avoid that. Okay, so
Is it part of normal aging, doctor?
yes,
It
yes,
is.
yes. If you age, no, starting from the 45 years old and going up, your prostate will grow bigger.
It's really something
it
that
is
may
inevitable.
happen.
It is
Yes,
unavoidable.
inevitable. Okay.
Lalaki-lalaki yan. No?
I see.
85% of all men will have an enlarged prostate.
Okay.
Okay, all men. No, so but only 15 to 20% of them will give symptoms. Will show some symptoms like frequency, dysuria, nocturia, feeling of residual urine, and weakness of urination, something like that. Okay.
Okay.
Now, once they develop these symptoms, and this is the time we give this medicine. But sometimes, even taking this medicine, if they have become refractory to medicine, that means kahit na umiinom po sila ng gamot, hindi pa rin nag-i-improve yung condition nila. And this is the time we advise them to undergo surgery. No?
Okay.
So, ang pinakamaganda doon, marami pong paraan para at least hindi na kayo hihiwain, no? So, marami na pong paraan ngayon, no? So, pinoprovide po natin dito sa St. Luke's. Ang ginagawa namin, there's what we call laser surgery or enucleation of the prostate. We
Laser surgery.
Yeah,
and
so
enucleation.
enucleation,
Of the
laser
prostate.
enucleation using thulium or holmium laser.
I see. So you
Okay.
don't need hindi na kailangan humiwa.
Hindi na
no?
kailangan huwain, no? Although matagal na po ito. Pero the most recent now is we do enucleation. We use laser. Thulium or holmium laser. No? And aside from that, there are a lot of advances with regards to the treatment of enlarged prostate or benign enlargement of the prostate. Now, if you start to develop cancer, no? So usually it's just like any other cancer. We want to detect this earlier on. No? If you have a history of cancer in your family, regardless if it is breast cancer, lung cancer, or liver cancer, or any cancer, if they have a history of cancer in your family, you are at risk of developing cancer also in the prostate. So
Yes.
that's why we advise earlier screening. No? Anong age yung early screening? Ibig sabihin 40 years old or 45 years old. No? So if you have a history of cancer, you have to seek consult from not really from a urologist, but at least to a internist or general practitioner to have your PSA check.
Yes, it's a blood test lang
It
po.
is a
It's
blood
just
test. It is a blood test. At least-
Prostate-specific antigen,
Yes,
PSA.
prostate-specific antigen. Okay? And then you let the doctor interpret that. No? So hindi po lahat ng mataas ang PSA cancer kagad.
Yes.
No? So they have to interpret that. No? Hindi po kayo nag-interpret niyan. Dapat yung doctor or specifically mas maganda kung urologist because there are a lot of conditions or a lot of situations that will give you an elevated PSA, but not really cancer. If they found out that you have an elevated PSA, and then that's the time we advise for a biopsy. The recent advancement in the detection of prostate cancer is that we can easily pinpoint which part of the prostate is affected by the tumor. So by doing multi-parametric MRI, we can easily pinpoint which part of the prostate has the tumor. And then we will fuse this with an ultrasound, what we call an MRI fusion biopsy, okay? And then we will locate the specific tumor, and then we do the biopsy on that specific part. So that means
it's a targeted
this is a
biopsy.
targeted, not really the therapy, but targeted biopsy. So it will give us a greater yield of detecting prostate cancer.
That's good to hear, Doctor.
Yes, and we can specifically stage the tumor by just doing the biopsy, the specific site of the tumor.
And this would lead to better treatment
Better
plans.
treatment,
Yes,
earlier treatment, and we can hope for cure. Not only for treatment, but cure.
Really cure cancer. So, Dr. Dodge, let's move on to possible misconceptions and stigma na surrounding men's health or urologic health. Would there be common stigma, sir, or misconceptions that you
there are a
encounter?
lot actually. There are a lot. Let's start with an enlarged prostate.
Enlarged prostate.
So, ang iniisip po ng mga pasyente when they go older, kasi tumatanda na ako kaya nahihirapan na akong umihi. It should not be. So, it should not stop you from enjoying your life by just getting older.
So, wag po tayong papayag na
hindi tayo papayag.
Mahirap umihi.
Mahirap
It's
ang
not
umihi
normal.
kasi matanda na ako.
Ayusin,
Sasabihin mo matanda na ako. So, hindi po dapat. Nagagawan po ng paraan yan. We can give you something to improve your life, to improve your
Quality
urination.
of life.
Not necessarily doing surgery, but you can just give you medicine to improve the flow of your urine.
Okay, so that's one.
That's one misconception. The second one is with regards to erectile dysfunction. So kapag before kasi ang sinasabi nila ang erectile dysfunction kasi is nasa isip lang. It's purely psychological.
Yes.
But now mostly 80 to 90% of erectile dysfunction we found out that there is an organic problem. May dahilan. So one of them probably is sobrang taas ng cholesterol mo.
Cholesterol can lead to
you have dyslipidemia or you have coronary artery disease, meron ka palang sakit sa puso na hindi mo alam, may obesity ka, masyadong mataba, so these are the usual condition that will attribute to or that will contribute to the symptoms of erectile dysfunction. So these are the misconception. Akala nila nasa isip lang yan.
So that's the second misconception.
That's the second. And the third and yung with regards to prostate cancer. So ang sabi nila before, hindi ka papatay o hindi nakakamatay yung prostate cancer. Although sa lahat ng cancer naman very slow growing, So slow growing prostate cancer. Sometimes if you read some books, they will tell you that people die with their prostate cancer rather than of their prostate cancer. So that means hindi po sila pinatay ng prostate cancer, So namamatay sila together with the prostate cancer. So they die of some other reason other than prostate cancer. So that's why when the patient reaches the age of 80 and up, we don't usually treat the prostate cancer aggressively.
Not anymore.
But of course, it's still the choice of the patient. We will lay the cards on the table and let the patient or the relatives of the patient to choose which one is amenable to them. Kung ano yung gusto nilang treatment, they bigay sa kanila or tanggapin nila. But more importantly, we tell them that when they reach the age of 85 years old, baka they die of some other reason other than prostate cancer. But of course, the most important is we have to let them live comfortably. Hindi sila hindi nahihirapan umihi, or they will not make them debilitated because of the symptoms of prostate cancer.
And it also goes without saying that we still want to detect prostate cancer, especially in younger males.
Yes, that's
because
right.
Because pwede pa rin po talaga siyang makapatay.
Cancer pa rin ho yan. So,
it's just that if it's in older people, baka there's a chance or a choice that the patients can make.
The problem is we cannot tell which type of tumor or prostate cancer which is aggressive or
Aggressive.
indolent. Hindi natin masasabi yun, no? So we just have to treat all prostate cancer to be aggressive type. That's
Yes.
why we have to treat them aggressively.
And early as possible.
Yes, that's right. That's right. So that's why we have to institute the treatment early. We diagnose them early so that we can easily institute the treatment early.
Doc, finally, what advice would you have for our viewers, especially the males, regarding their urological health?
It's just like any other diseases. No, we want to catch the disease early, so that we can institute the right treatment early. No, so with regards to enlarged prostate, especially if it is benign, and they will start feeling the discomfort from the symptoms, what we call lower urinary tract symptoms or LUTs. No, so like difficulty in urination, weakness in the urination, or splitting of urine, feeling of residual urine, and then if the patient is a male and start to develop urinary tract infection because of retained urine, and this is the time time to seek consult from a urologist. No? So they can give you an advice and they can give you medicines to treat your problem. Okay, so with regards to prostate cancer, so just like any other cancer, we want to diagnose it early so that we can treat it early. No, so if you have a history of cancer in your family, might as well seek a consult from not necessarily from a urologist, but at least from a general practitioner or internist, so that they can give you a screening. No, so they
Yes.
can ask for a PSA or even rectal examination to check if there are signs of prostate cancer already.
Thank you, Dr. Dodge, for sharing your insights with us today.
It is always a pleasure, Jing. So if you are free again, I can squeeze some time so that I can do this interview again. Thank you.
We'll definitely invite you again, Doctor. So remember, taking care of your health is not just a priority, it's a necessity. And this is Jing. Thank you for tuning in to MD in Focus. And remember, your health is your greatest wealth. Always consult your specialists and doctors for more reliable health information. Remember to click the follow button. And until next time, stay well.